Good morning, and thank you so much for being with us this morning for a webinar called A Trauma-Informed Approach to Conversations about World Events. And this is led by Ramya Shanmugadalayitham. So many of us have experienced conversations about what's going on in the world with friends or neighbors or colleagues, and something just triggered a pretty intense reaction. And that might have been in the other person or even in ourselves. And we've wondered, where did that come from? So this morning, we're going to look at how trauma can influence reactions to news about what's going on in the world, and how we might recognize trauma and respond appropriately. So my name is Katie O'Leary. I'm the director of engagement, as well as continuing and professional education here at Hartford International University for Religion and Peace. So that is really long. Also Hartford International, or HIU, if you want to shorten that a little bit. So we are offering this and other similar programs through something called Continuing and Professional Education. This is an initiative where we offer learning opportunities for thriving in a religiously complex world. And this is for both individuals and for organizations. This is in the form of webinars like this, or workshops, trainings. If you'd like to learn more, reach out and get in touch with us. So this morning will consist of a presentation followed by Q&A. So those two parts. Anytime, just put your questions in the Q&A box and we will handle those at the end. And now I'd like to introduce Ramya. She is a licensed clinical social worker and psychotherapist, as well as an educator. She helps individuals and systems embrace diversity, heal trauma, and support neurodiversity through an anti-racist lens. At HIU, where she teaches, she is a program fellow for our Masters of Arts in International Peace Building. Sometimes we call that MAP. And she's currently teaching something called Trauma Healing from the Inside Out. And with that, Ramya, take it from here.
Awesome. Thank you. Thanks so much, Katie. And thank you all for tuning in today. I know that there has been a lot kind of going on in our world, a lot of things that have caused heaviness, and it just felt fitting to sort of respond to this in a trauma-informed way. And so I'm going to kind of start by sharing my screen, and we'll take it from there. Great. So as Katie mentioned, we kind of have this title of Healing from the Headlines, a Trauma-Informed Approach to Conversations about World Events. And so I wanted to start off with this quote. It's when we start working together that the real healing takes place. Because I think that is part of the intention around gathering folks today and doing this webinar is recognizing that despite the fact that sometimes when things happen in our world, it can create divisiveness, that ultimately healing can be a collective effort. So what we'll do today is we'll kind of define trauma broadly. We'll talk about how trauma shows up in our brains, bodies, and narratives about ourselves and others. We'll look really specifically at intergenerational trauma and cultural trauma and define and understand those. And then we'll talk about vicarious trauma and how we see that playing out and interacting with the current events. And we'll end by talking about calming the nervous system to ground and connect. And then we'll kind of open things up for Q&A. But before we started, I know that sometimes to be listening and to engage, our nervous systems have to be in what we call a window of tolerance. And I'll talk more about that later. But I just wanted to run us through a quick breathing exercise to sort of allow ourselves to be present. I don't know where folks are coming from or what time of day it is, even where you are. But often our nervous systems can get activated by whatever it is that is happening in our world. And when we breathe, it slows our systems down and often brings us back into a window of tolerance. So we're better able to take in information. So this one, I do work with kids, and I used to work in elementary school. So this one is a really good one for kids and adults alike. You take your hand out, and as you trace along your finger, you breathe in, and then you breathe out. You can do that together. Breathe in and out, and in and out, and in and out and in and out. And I love that one because you can give yourself a high five afterwards. All right. I also do that partially because even the word trauma can sometimes be evocative for people, and an alarm can be sound in our bodies, even when we hear that word, depending on our life experiences. And so when I define trauma, there's a lot of different definitions of trauma out there. I really appreciate what Resmaa Menakem writes about trauma. He says, contrary to what many people believe, trauma is not primarily an emotional response. Trauma always happens in the body. Trauma is not a flaw or a weakness. It is a highly effective tool of safety and survival. So a lot of people think about trauma as being a person, when someone has been like victimized by something. The classic kind of construction of trauma comes from folks who have come back from war. A lot of times the sort of PTSD label, post-traumatic stress disorder, was born out of looking at symptomology in veterans. And so a lot of times people think in order to be experiencing any form of trauma, you have to have had an experience that is that significant. And that it is something that is emotional, like it's an emotional response. But actually, trauma is something that lives in the body. Resmaa Menakem also says trauma is not an event. Trauma is the body's protective response to an event or series of events that is perceived as potentially dangerous. So sometimes people think of trauma as a weakness, like, oh, you have trauma. Classically, when we think about war veterans, there's a hesitance around a PTSD diagnosis because it sort of says you're vulnerable. But actually, trauma is the adaptation that your body has done from a place of resilience. So in fact, even if trauma is framed as a sort of bad thing, really what it is it's an adaptation. Another way of looking at it is trauma is about stuckness, the stuckness in ideas, the stuckness in behavior that over time looks like normality. Usually, so my primary kind of modality or primary lens of looking at the world comes from being a psychotherapist. I work in private practice with children, adults, and couples. When I talk about trauma, I really just talk about it as stuckness, any kind of stuckness. Often we can see that stuckness playing out when we think about a past and present connection. So I want you all to just imagine a lemon for a second. And I know there's one up here, but you don't have to imagine this particular one. And just imagine kind of what it looks like, what it feels like, what it will taste like. If you do that, you might notice a little bit of a feeling coming into your mouth as though the lemon is actually there. And that is because our brain, even if something is not there, if our brain imagines it or has some kind of sensory input related to it, our body will respond as though it is actually there. So often, something that has happened in the past can trigger a response in the present simply by thinking of it or having some kind of exposure to it. I want you, for example, to imagine math class. And this might seem like a kind of silly example, but I think it's been demonstrative in contexts I've shared this before. For some people, math class is a place that immediately sends the brain a threat response of, oh, I'm bad at math, like I'm not good at this. Like you might have a memory of a previous classroom where you struggled. For other folks, math class might evoke a sense of competence, of feeling like, oh, I'm really smart, I'm really good at this. When you think about math class, you might notice something in your body, something that might be really positive feeling, something that might be a little bit negative feeling. But the fact that our body is responding to this concept or this trigger is an example of that past-present connection. I really like this other quote by Resmaa Menakem. He says that trauma is a wordless story our body tells itself about what is safe and what is a threat. Our rational brain can't stop it from occurring, and it can't talk our body out of it. This is really important because a lot of times when we think about trauma, we think about things like triggers. And with triggers, we really can't stop our body from having a triggered reaction, right? So if we're watching something in the news or seeing something pop up, our body will respond even if we tell our brains that we're okay and that thing is happening far away. Our body is still being impacted by it. We also begin to tell ourselves stories about those things. And so coming back to this idea about trauma being stuckness, and thinking about it as the stuckness in ideas, a lot of times when something difficult has happened, something too big for our systems to cope with, that's another definition of trauma, is anything that is too big, too fast, too much, that it overwhelms the system such that it can't fully process or make meaning of it. When that happens, oftentimes we consolidate the memory of that thing through a thought about ourselves or the world. So a narrative forms based on being not able to process all the complexities of an experience. We just kind of, our brain creates a soundbite of sorts. So thinking again about math class. When we think about it and process the experience of being in an educational system or thinking about math, we might be able to see it in multi dimensions if it's been processed. If it's not, we might just come up with like a pithy soundbite that tells us like this is our experience of ourselves or our world. So when I think about what's going on in the world right now, what I see a lot from folks I see kind of in students, in clients, is a really oversimplified narrative about oneself or the world. So common things I hear are, I am alone, there's nothing I can do, I'm not safe, nobody cares about me, or nobody cares, or I'm powerless. Um, so you may be feeling some of these things, or you might have heard people you love say some of these things. And even though these are really real feelings, sometimes these thoughts or feelings come from some kind of past present connection, that perhaps we have felt this way before. We haven't had the chance to process that feeling fully to come up with a more complex narrative about ourselves or the world. Thinking, for example, of the idea about nobody cares. I've heard that a lot from a lot of people who care very deeply. And so the feeling that nobody cares may very well be there from previous experiences, but the reality is a lot of people care a lot about a lot of things right now. But our brains under stress don't always get to understand that kind of complexity. So I want to also talk a little bit about what's going on with our brains under stress. And so a key concept that a lot of folks in the mental health world talk about is the window of tolerance. Juliet Young, she's a clinical psychologist in the UK. She does a lot of like beautiful little doodles that I feel like really resonate for humans and people just kind of out in the world who aren't trained therapists. And so I really love this image. I mentioned earlier about how when we did the finger breathing, that was an attempt to keep us in our window of tolerance. Our window of tolerance is basically our nervous system when it is socially engaged, when it is feeling like calm but comfortable to engage with the world. It's sort of the optimal place for our brain. It means that we are regulated emotionally, but also and mentally, emotionally, and physically. Sometimes when we're exposed to something, we come to this kind of place where we hit a trigger, and then we sort of start to escalate. If we escalate enough, we're going to go into a place of hyperarousal. So that term is usually just talking about any time our nervous system isn't in a really calm place. So I know this webinar is kind of part of a series, and in the first webinar that Phoebe gave, there was a discussion about having conversation or dialogue about difficult things. Oftentimes, when we're having these kinds of conversations, there might be something somebody says that is a trigger that puts us into from a place of kind of optimal window of tolerance into a place of hyperarousal. At some point, that might get so bad that we hit a point of overwhelm and then we shut down. So a lot of times people think of fight, flight, or freeze, and fight or flight being hyperarousal, fight or flight being hyperarousal, and freeze being hypoarousal. And sometimes people think of those as just different choices, but actually hypoarousal or freeze response, sometimes that looks like feeling numb, frozen, shut down, needing to be silent, not being able to take any kind of action. That is actually a response to feeling so overwhelmed, of feeling so many feelings that you actually can't feel anymore. Sometimes people just think it's just like sort of three pathways and your body kind of chooses one of the three. But I think it's important to note that a freeze response is actually because there is too much going on. There's too much to feel. Your system is so overwhelmed that you have to actually your brain has to shut yourself down completely. So another thing I've been hearing a lot from folks lately is people talking about how folks are silent. And this is really hard because there is an understandable feeling of concern around silence. And also, when our nervous systems hit a point of such overwhelm, we lose access to language. And so even if someone wants to speak, they might not be able to. We also might be frozen by just being completely numb, needing to check out of our kind of relationships, of our workplace environment. And so sometimes we can criticize folks who are in that kind of place when really it's a sign of not having the nervous system, not having the capacity to stay engaged. So this is a really kind of helpful framing to look at what's going on with our nervous system, because when we think about having dialogue, it's also really important to check in with our bodies about where we are and if we're ready or able or have the capacity to have a dialogue. You also want to talk about intergenerational trauma. So I have a lot of quotes from Rusman Menakem. He says, whenever one group oppresses, victimizes, brutalized, or marginalizes another, many of the victimized people may suffer trauma and then pass on that trauma response to their children as a standard operating procedures. Children are highly susceptible to this because their young nervous systems are easily overwhelmed by things that older, more experienced nervous systems are able to override. As we have seen, the result is a soul wound or intergenerational trauma. When the trauma continues for generation after generation, it is called historical trauma. Historical trauma has been likened to a bomb going off over and over again. I bring this up and I'm kind of providing an example specifically of a South Asian context because I'm Indian American and this context is one that resonates with me. And this kind of image is speaking to what we see happening generationally based on what has been described kind of at the top here. And so I'll actually give a little bit more detail talking about the partition of 1947 as sort of a case example of intergenerational trauma. So in 1947, when the British left India, there was a division of India into two states, India and Pakistan. And so Indians sort of stayed in the state, or Hindus stayed in the state of India, and then there was the largest mass migration of folks into Pakistan. During that time, there was a lot of violence and a lot of difficulty that impacted Indian and Pakistanis. What I see kind of in my practice as I work with a lot of South Asians is a number of things that have passed down intergenerationally. So there's unprocessed grief responses. A lot of what I will see is Indian and Pakistani Americans trying to sort of get married, but the legacy of partition playing out in their family relationships. I also see identity issues among South Asian Americans. So looking back at this idea, it's the idea that something that may have happened years ago, multiple generations ago, may pass down over time to the next generations. And so this is challenging, and it's a concept I think is playing out in our world events right now, where narratives and stories and experiences that have impacted folks are being passed down and held from one generation to the next. Kind of similar to that is the idea of cultural trauma. And so this is another Rusman Menakem quote. He says, sometimes trauma is a collective experience, in which case our approaches to mending must be collective and communal as well. So Heller and Kramer, who are the folks who've kind of created NARM, or who have written this most recent NARM text, talk about cultural trauma as large environmental failures, including racial, gender, sexual, ethnic, religious, and socioeconomic oppression. These forms of trauma generally impact those who are marginalized by the dominant society and not afforded equal access to basic human rights. Individuals and communities impacted by cultural trauma may internalize patterns of oppression, objectification, and subjugation in order to survive. So intergenerational cultural trauma can be a type of intergenerational trauma. So cultural trauma is essentially when any particular group of people have been marginalized in some way. And that can be on the basis of any of these categories: race, gender, sexuality, ethnic identity, religious identity. The key about cultural trauma is that it occurs when members of a collective group are subjected to something kind of horrible that leaves an indelible mark upon their group consciousness. Alexander sort of says that that marks their memories forever and changes their future identity in a fundamental and irrevocable way. What's really challenging right now is that anyone who has come from any kind of marginalized identity as a group or a collective has probably experienced cultural trauma. Um, and that can kind of color narratives about self and others and who is safe and who is not safe. We see that playing out right now. Cultural trauma can also, it is a collective trauma, meaning that it impacts a collective group of people, and it can be historical, meaning that it can pass down from generation to generation. I also wanted to talk about vicarious trauma, which I think is perhaps most relevant to those of us logged in today. Vicarious trauma is the emotional residue of exposure to traumatic stories and experiences of others through work, witnessing fear, pain, and terror that others have experienced. A preoccupation with horrific stories. It can be told to the professional. This is kind of taken from APA, so it's really thinking about what counselors or helping professionals might be experiencing. But vicarious trauma can really impact everybody. And so what I've been hearing a lot of people say is that when they're sort of looking at media, it's really hard because when we see difficult images, we are impacted by them. And sometimes that is through feeling like fear and pain and grief and sorrow. But depending on where we are in our window of tolerance, we might also be feeling numb. And so vicarious trauma is really important to think about because it is something that is likely impacting anyone who is engaging with the news, as the news tends to show some pretty difficult things. I wanted to go over symptoms of vicarious trauma so that folks that are listening today might be able to recognize what this is. Because a lot of times when we think about trauma, we think of what is described as capital T trauma or some of these really big, colossal life events. When in fact, just watching a lot of social media and intaking difficult images can be another form of trauma that many of us might be experiencing actively. So at the behavioral level, what that could look like is you might have sleep difficulties, nightmares, have poor appetite, or be overeating. You might feel hypervigilance, an exaggerated startle response, difficulty remembering things, kind of disorientation that might look like clumsiness or forgetting things. It might escalate to self-harm behaviors or negative coping like substance use. At the physical level, what people might experience are physical symptoms like sweating, rapid heart rate, difficulty breathing, dizziness, aches and pains, or weakened immune system in some way. So, I mean, recently, I think we've had kind of like the perfect storm of both exposures to violent and difficult images and a lot of illness. And some might argue that those things are related. And of course, there are health reasons as well, but a lot of times our immune system is impacted by a stress response that might come up through intaking difficult things. At the cognitive or mental level or mind level, there might be a minimization of vicarious trauma. I hear a lot of people say like, the least I can do is watch this stuff or read this or speak up. And that can kind of be an encouragement to like taking in more difficult images or more difficult media. Sometimes we see lowered self-esteem and increased self-doubt. That kind of goes back to the different thoughts people might have about themselves. There might be trouble concentrating, confusion and disorientation, perfectionism, racing thoughts, loss of interest in previously enjoyed activities, lack of meaning in life. And then again, it might escalate to thoughts of harm of self or others. At the emotional level, you might feel helplessness and powerlessness. I hear a lot of survivor's guilt right now. numbness, oversensitivity, emotional unpredictability, fear, anxiety, sadness, or depression. And then socially, people might withdraw and isolate. They might feel lonely. That idea of feeling like I am alone is coming up a lot right now. Irritability and intolerance, distrust, projection of blame and rage, decreased interest in intimacy, and then changes in parenting styles are also a possibility. So what do we do all this? I spent a lot of time defining a lot of different types of trauma. And the reason I do that is just one of the biggest pieces to doing something is having insight to know what is intergenerational trauma, what narratives and stories and experiences have been passed down to me that impact the way that I look at myself or I look at others. That's kind of the first step. And then these are three other areas that we can look at. And so the first is grounding ourselves in the present. The second is pendulating difficult exposures. When I talk about pendulating, I'm thinking about like a pendulum kind of moving towards and away from something. So when we're exposed to something difficult, like challenging media, or if we're processing some kind of trauma, being able to move towards it and kind of dipping our toes into talking about it, but then also being able to move away from it to stay in our window of tolerance is really important. And then the third is processing past or current traumas. So maybe that is delving into intergenerational things. Maybe that is looking at something like vicarious trauma. So talking about staying in the present, this is really important if we're trying to have any kind of dialogue or discussion with someone. The really challenging things about our nervous systems are that they really suck at understanding context. So, I think about, for example, my husband and I, in our first year of marriage, we would repeatedly get into conflicts around like 5:30, 6:30 p.m. And then magically, after we ate dinner, the conflict would be resolved. And slowly we implemented this rule, like no difficult conversations before we've had dinner. And since then, we've found so much more success in having dialogues, because when our blood sugar gets low enough, our body starts to sense a threat in our system. I mean, we joke about this being hanger, but there's a real reality to if our bodies are not grounded in the present, if our bodies are not well nourished, and not sensing threat, we're not going to be able to be using the highest faculties of our brain to understand complexity. And so being grounded in the present and taking care of our bodies in the present, a real precursor to being able to have any kind of effective dialogue. So I provide these two really quick strategies because I think that they're really easy and anyone can use them. This is something adults can use, but you can also teach these to your kids as well. So the first idea is holding your hand in front of you and imagining a flower in one hand and a candle in the other. And breathing in as though you're smelling your favorite flower, and then blowing out as though you're blowing out a candle. And doing something like this before you go into a space that you think might be challenging or enter a conversation that might be hard can be really helpful. The second idea is a 5, 4, 3, 2, 1 grounding technique. This involves telling your brain you are in the present by taking in the sensory input. So looking at 5 things you see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Going back to the idea of that past-present connection, sometimes we don't know that we're being triggered by something we've seen. It might be something as simple as hearing a sound of like an alarm or a smoke detector. And our nervous system is unconsciously being activated. But when we look at what is in our physical environment, when we touch, taste, hear, when we tune into our senses in the present, our brain comes back to the present. It's not stuck in the past. So these are a couple things we can do to ground ourselves. Next, pendulating in and out of difficult exposures. Part of that is caring for a physical self. What I've noticed a lot with people being exposed to challenging things in the media is this idea that I mentioned before, this is the least that I can do. And I advise people to avoid sympathy suffering. This is actually something my therapist has said to me. She has said, nobody's suffering has made anybody else's suffering easier. And sometimes we put ourselves through difficult things because we feel like we can't experience goodness when others are experiencing things that are difficult. And often what that does is just deplete us. It takes us out of this optimal place um, of our window of tolerance. It puts us into kind of this area where we start to escalate, which means that we can't show up for the people or things we care about in the way that we'd like to. And so I often recommend, to not avoid the things that are good out of a place of wanting to reduce one's own well-being out of some kind of empathy or sympathy. Avoiding doom scrolling, which is the term doom scrolling is that the tendency to continue to surf or scroll through bad news, even if the news is saddening, disheartening, or depressing. Balancing difficult exposures with positive experiences of joy and gratitude. Adding sensory pleasures into our daily lives. Something as simple as having moisturizer can bring us into our bodies, a candle, drinking a beverage of some sort can bring us back to our bodies. And the more that we're staying in our bodies, the less likely we are to be in a past place that might have some difficult emotions that are related to a trigger. And then enforcing limits and boundaries. So things like saying that you're only going to check social media once a day, telling yourself, I'm going to take 3 actions around advocacy, and then then I'm done, but really setting some limits and parameters in place so that we're not kind of overexposing and overacting or acting from a place or overextending ourselves beyond what's going to be sustainable. And the third is processing the past or current traumas. And so that's for reflecting on past present connections that might be impacting us, exploring our own family narratives of cultural and intergenerational trauma, and then seeking support for vicarious trauma. And all of those are there's so many different resources for doing that. There's no one right way to process or heal trauma, but these are kind of generally what we can do. And so I just wanted to kind of end with a couple of points about creating dialogue, some kind of principles to think about. A regulated nervous system is a prerequisite for dialogue. Before engaging a conversation, you might choose to ask somebody, do you have capacity for a conversation about XYZ? Sometimes we begin a conversation when we or the other person is just not in a place nervous system wise to really think and be present to the conversation. And so asking if a person has capacity before engaging the conversation and checking in with ourselves if we have capacity is really important. Our nervous system can also see differences between us and others as threats, and even a loved one can become an enemy. Like if you come to my home at 6 o'clock when I have not eaten anything since like an early lunch, you'll see that the person whom I love the most, or I love a lot, my partner, can become my enemy simply because I haven't eaten enough, right? And I might see him in a sort of adversarial way, but when I see both of us as people who just need to eat dinner first, and I see us as sort of having a shared experience, it helps us connect, right? And I make kind of a light of this and use this joking example, but it's really true, is when we see ourselves in others can really help our nervous system feel a sense of connection and closeness and openness, as opposed to sensing a threat. And then be aware of when and where you are dipping outside of your window of tolerance. Pour back into yourself before getting to the point of overwhelm. Take breaks by saying things like, I need a break from this conversation. Can we circle back at X time? Because again, if we're past the point of overwhelm, we literally can't access the parts of our brains that are going to be most open to complexity. And so it isn't going to be a productive conversation if you've hit a point of overwhelm or starting to shut down. So I also remind ourselves to pace ourselves in these conversations, and to the extent possible, when we can add playfulness into our life. Playfulness is a lightness that breaks through disconnection. That can be helpful. Acceptance, unconditional acceptance of thoughts, feelings, and needs, and recognizing that the way we feel right now we don't need to judge that, but just accept it. To have curiosity, trying to understand what's behind behavior of ourselves and others without holding judgment. And then empathy, connecting with the person's inner world with compassion, that of ourselves and others. So I just want to remind folks to pace ourselves in all this, because there will always be news that is really challenging. And as our world becomes more interconnected, our exposure becomes more frequent. And it's really important to pace ourselves in all this. And so I leave us with this quote: there is no timestamp on trauma. There isn't a formula that you can insert yourself into to get from horror to healed. Be patient, take up space, let your journey be the ball. And so this is my contact information. If folks have questions, they're welcome to reach out to me directly. If your question doesn't get answered in this Q&A, I'm also available. You can come to my website, ramyas.com, or I'm on different social media as therapist.ramya. They're really appreciative of being able to share and
Thank you.
Yeah.
Thank you so much. This has been wonderful. Talk about content rich, and I love all of the coping, suggestions and the details. So thank you. It's beautiful. I was smiling, remembering that there have been several times over the course of my marriage when my husband has responded to something I've said with, "Can I get you something to eat?" So it so resonates.
Yes.
We got a lot of questions. It really resonated what you said about pendulating, balance. Everybody wants to be informed, but we know how tricky this is when images and things get into we can't get them out. So if you could speak a little bit more about, this whole idea of not doom scrolling and that sort of self-care.
Yeah, I think what's really important is knowing that there isn't kind of a right amount of exposure for any given person, and to really learn to get in touch with your own body. Like self-awareness of one's own internal world is so vital when it comes to staying in an emotionally good place. So some people have a really high threshold, and so that's okay, and other people don't. But I really recommend folks balance the things that are really challenging for them with noticing the things that add pleasure. So I recommend thinking through your senses, like what do you like to look at? So Katie, you have a bunch of plants, so adding plants to our world, maybe it is like there's certain colors. Thinking about what we like to smell, like what kinds of scents do you want to have in your home? What do you like to touch? I have like manipulatives near my desk, like a unicorn. And so you can still be empathetic to current events while also taking care of your own bodily needs, and really thinking through a sensory lens will get you back in the present. So that's what I'd recommend.
Thank you. Wonderful. Stuckness. The benefit of defining trauma as stuckness. Wondering about how you avoid it seeming to maybe minimize the seriousness of intense trauma. Can you speak to that?
Yeah, that's a really good question. And I think it's challenging because people don't want to feel like they're overusing the word trauma. I think sometimes we want to reserve like capital T trauma to victims of things that are horrible. And so I can totally understand the perspective that like stuckness is minimizing. But I also think that framing is really important to be able to think about what's going on in the body. And of course, there are capital T and lowercase t traumas, right? We're not equating a difficult math teacher to like atrocities of war. And at the same time, our bodies may experience those things somewhat similarly. And that might be really like surprising because we don't want to minimize certain experiences and the severity of them. But I'd really look to like the way in which it is impacting functioning to better understand the intensity of trauma. So if something is impacting your life in a daily persistent way, that's something that we'd want to get more care around. You might have had an exposure to something that has created a stuckness that doesn't impact your life at all. You may be like, I am an artist now and I don't really care about math. And I have a friend who always tells me what to tip at lunch. And so that may be the kind of stuckness that has a past present connection. But if it's not interfering with your world, it may not be something you want to characterize in that way. So I hope that helps.
Yeah, thank you. Thank you. Interest here, a lot of interest in, you talked about sympathy suffering. How might you help someone who seems to be depriving themselves of joy because it seems like solidarity.
Yeah. Well, I'd wonder, where did that idea come from? Because if the idea that I'm not allowed certain things because someone else is suffering, it may actually be a kind of over responsibility that has a historic basis. So that's when I'd really encourage people to think about your own kind of narratives and what narratives you have about yourself and whether or not you're deserving of things. I really understand that perspective of feeling like guilty or feeling shame, if you're enjoying something while other people are not. But truly, from a logical perspective, our suffering, adding self-imposed suffering isn't virtuous. We're not taking away someone's suffering by adding to our own. We're only depleting ourselves of the capacity to show up for others. So I'd really think, where did that idea come from? You know, a lot of times we see, truly, if I'm being really candid, we see a lot of like women in the world who like take on a lot of stuff and don't care for ourselves. And a lot of times we see people then saying like, oh, I have to do the same thing. And it doesn't have to do fully with the current events. It has to do with the context, the familial context in which we were brought up and the messaging we have about our wellness relative to others. So really interrogating that is what I would recommend.
Excellent. We have a lot of questions. Here's one, you've been helpful in describing, you talk about setting up a conversation, asking, whether this is a good time, and this is for especially difficult conversations. Speak more to that, please, about the steps of that.
Yeah. So, I mean, I would certainly for difficult conversations, but I would say any conversation, right? And I mean, if you're trying to talk about something where you're really engaging someone in a critical dialogue, I would first start with checking in with yourself.
Mm,
Sometimes we have an anxiety around talking about something because we want to express ourselves, but we're not in a position to be able to hear, right? We're not going to have curiosity. So being able to check in with yourselves about, am I just as capable as listening to the other person as I am about my expressing myself? Or do I need to just express myself? And it's okay to say, like, do you have capacity for me to just express myself about this? Like, I don't have capacity to hear, but I really like appreciate some space to share. And someone can consent to that conversation or not, right? They can say, no, I don't have capacity for that now. We can have a conversation, at this time. They can say, yeah, I'll hear you out now. And, I hope that I can share my perspective later. But really checking in with yourself first to see, what is my intention around this conversation? And then checking in with the other person and seeing, what do they consent to? But we really want to talk about like conversations that come from a place of self-awareness and
mm.
consensual conversations.
Got it. This is somewhat related. Somebody's expressing that it's difficult to balance action, advocacy, accountability, and challenging events with self-care and sustaining our own mental health. And as you said, just really being grounded in yourself. Ideally, we'd sustain ourselves to the point where we can effectively create change, often fall into escapism. Again, I think this goes back to this word I love of yours, pendulating. How do we navigate this?
Yeah. I really, recommend thinking about what your role is in different movements and in efforts, and really thinking about what are your strengths as a person. I believe that we've all been given unique strengths and talents. And so we don't have to do everything just because people are urging us to do everything. And something that can help keep us within our window of tolerance or just at the edges is staying within our skill set. Like if you're a writer, write. If you're an educator, educate. If you're a person that, reaches out to politicians, that's what you do. If you're a person who, likes to make artistic things, build something artistic. But really figuring out like, what is my like divine kind of talents and how do I use that can be a way to consistently move towards what you're hoping for, but without overextending yourself into places that your nervous system may just not be ready for.
In these conversations that we have, how do you really tell the difference between trauma and what might just be kind of stress, general stress?
Yeah, I would look to the idea of how is it impacting functioning? right?
Mm.
I mean, when we think about like what PTSD, for example, the criteria of that, part of that is re-experiencing. So if something is stuck in your system as fragments and you're re-experiencing it, that is a telltale sign that something is traumatic. If you feel stress, but then it passes and the past stays in the past, then we know, okay, that was stressful. So sometimes we have like something like an exam. It's really, really, really stressful. You might have even gotten like a really bad grade on it. But when it's over, you're just like, okay, it's over. If something keeps coming back into your system, that's really a sign that this is trauma. And if you have to do something to cope that is
Mm.
also inhibiting your life and not making your life better, that's also probably a sign that this could involve some intervention.
Cultural trauma, you talked about that. Societal trauma, is that the same or different? And with what's going on in our country, even polarization, is there a difference?
A good question. I don't actually know how we would describe societal trauma. Like, I'm not sure
Mm.
what the literature says about that. I think when I'm thinking about cultural trauma specifically, it usually is a function of something happening that impacts identity in some way. So if a particular group feels like victimized or feels like less than, that's often a sign that something has happened that is cultural trauma, versus things can certainly happen systemically and societally, like when like going through a pandemic, like there is sort of societal trauma in that. But I don't know actually what the literature will say about societal trauma. So I don't think I can answer that fully.
Okay. I guess in the minute or so that we have left, and I want to honor everybody's time, what would you suggest for people who recognize that help is needed when it comes to this? And I love your graphic about the different levels. If you would talk some more about that.
Yeah. Well, I'm a big believer in that there is not just one way to get help, right? And we live in societies that might say, oh, get a therapist, for sort of anything. And as a therapist, like I believe that therapy is valuable, but I really think about like what areas and avenues already create joy and healing
Mm.
for you. So I think about things in kind of 3 or 4 big buckets. So somatically and in the body, what can you do? So if you're a person who like exercise or dance and movement is a big release, like start there. I think kind of the next category I would think about cognitively. If you're a writer, if you're someone who likes to journal, you can start there. You can share your writings. You can do cognitive therapies. I think of the third bucket as being sort of spiritual practices. So what can you engage in spiritually that's healing? And I think of the fourth bucket as relational. So what can you do in community? But I certainly recommend things like therapy, but I also think if you have something that is working already, you can build upon that. And to the extent that something isn't working, that's when we start to explore new things. You can get professional support, you can get peer support. There's so many ways to get guidance and support and care. And I think it's really important not to limit ourselves or to think there's just one right way to do something.
Good counsel. Thank you so much. Thank you so much for doing this with us. We will share this information. We invite you to please sign up for our newsletter if you want to learn about more events and happenings, whether it's your continuing in professional education or just in general. So we're so happy to have had you join us. And Ramya, you are wonderful. And thank you very, very much.
Thank you so much. And if anyone didn't get their question answered, you are more than welcome to reach out to me to chat more. And thank you so
And
much.
we'll share that information. Yeah, awesome. Thank you.